Hello, I'm Beverly Wheeler, Director of DC Hunger Solutions, and I want to welcome you all to our Federal Nutrition Toolkit webinar. The Federal Nutrition Toolkit is designed to help community-based organizations, social service and healthcare providers, district agencies, and community members connect low-income households with federal nutrition programs. The toolkit can be found on dchunger.org, and we will put a link to the toolkit in the chat. Today's webinar will feature 3 panels from our partners, where you will learn about available federal nutrition programs for children and families, seniors, and other adults. We will allow time for questions and answers at the end, so we encourage you to put your questions in the chat. I also want to remind you that today's webinar is being recorded. I want to thank our partners, DC Department of Health, DC Office of the State Superintendent of Education, DC Department of Human Services, DC Public Schools, DC Department of Aging and Community Living, and the DC Food Policy Council. Thank you for attending, and we hope you find today's session helpful and insightful. Now for our first panel. We will be discussing programs for children and families. Presenters, please briefly introduce yourselves before our discussion. Let's get started.
Good morning, everybody. My name is Jessie Lupo, and I'm a public health nutritionist at DC Health within the Nutrition and Physical Fitness Bureau.
Hi, I'll try it again. I was on mute the entire time I was talking before. My name is Suzanne Henley, and I work with the Office of the State Superintendent of Education.
Michael?
Hi, my name is Michael Rebar. I'm the Deputy Administrator for the Division of Policy, Training, and Quality Assurance with the Department of Human Services.
Good morning, and I'm Kimberly Thompson. I'm a program specialist with the school nutrition team here at OSSE.
Perfect. Jessie, it's all yours.
Okay, wonderful. Well, the first program I will speak about today is the Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as the WIC program. The WIC program is funded by the United States Department of Agriculture. The grant is administered by DC Health, and the program is implemented by 4 local agencies: Children's National Hospital, Howard University Hospital, Mary Center, and Unity Healthcare. Among these 4 agencies, we have 13 service sites where eligible participants can receive services. As for eligibility, the program aims to safeguard the health of pregnant, postpartum, and breastfeeding women, infants, and children up to age 5 who are at nutritional risk, reside in DC, and meet income requirements. The program provides a variety of services. The first being free supplemental foods designed to meet the specific nutritional needs of program participants, aimed at improving food security and economic stability. Program participants receive food packages that contain food such as milk, cheese, eggs, whole grain products, yogurt, fruits and vegetables, and infant foods and formula. The program also provides health assessments and nutrition education and counseling by licensed registered dietitians and other trained professionals, along with breastfeeding promotion and support by lactation specialists in individual and group settings. These one-on-one services help support early childhood education and development, social cohesion, and health literacy. And lastly, the program aims as a bridge to healthcare, social services, and community providers to help participants connect to the resources that they need to support themselves and their families. During the public health emergency, participants receive services remotely through phone or video platforms, and program benefits and materials are sent through the mail. It is very easy to connect families to WIC. You can do so by going to our website at dcwic.org. On our How to Apply page, participants can take a pre-screening test to see if they qualify for WIC and then connect to a local agency site convenient to where they live or work. Or eligible participants can call our WIC sites directly or our WIC state agency. Next slide, please. Okay, the next program is called the WIC Farmers Market Nutrition Program, or WIC FMNP, another federally funded program. It is administered by DC Health and implemented by the same 4 local agencies. This program complements the WIC program. Pregnant women, new moms, infants 6 to 12 months, and children up to 5 years of age enrolled in WIC are eligible for these farmers market benefits. Eligible participants receive 6 $5 checks for a total of $30 to buy fresh fruits, vegetables, and cut herbs with approved farmers at farmers markets in DC and Prince George's County in Maryland. The program also provides nutrition education. Program participants learn about what's in season and how to select, store, and prepare produce that they have purchased using their benefits. The program runs between June 1st and October 31st. Participants who are enrolled in the WIC program during this time will receive their checks by mail or on-site at their WIC sites. And the program impacts the community in a variety of ways. It improves diet quality through access of fresh and local produce, improves nutritional literacy through nutrition education, and it supports small farmers and the local food economy. And more information about this program can be found on our website at dcwic.org.
Good morning, everyone. I'll be talking about the Child and Adult Care Food Program, or CACFP. Through the CACFP, organizations can serve children birth through 18 years old, and the program also has a component for functionally impaired adults and adults 65 and older. Locally, the program is administered by OSSE, the Office of the State Superintendent of Education. An organization interested in offering the program must apply with OSSE. After making application and having it approved, the organization will receive reimbursement funding for the meals that they serve to eligible participants. The reimbursement rates are set annually by the federal government, and the funding is designed to supplement the cost of meals. There is a structured meal plan that organizations must follow. The meal plan gives a basic outline of food groups and portion sizes that must be served. And as long as the organization meets meal standards, they are allowed to serve meals that meet the needs and tastes of their community. For example, serving culturally familiar foods and vegetarian meals are an option. There are also options to serve participants with allergies or those requiring specific meal accommodations associated with medical needs or disabilities. As an organization, to learn more about the program and how to apply, you should visit the OSSE CACFP webpage. Children and adults participating in CACFP will have access to meals at no cost. Depending on which meals the organization that they're attending chooses to serve, participants could receive up to 2 meals and 1 snack per day year-round, every single day of the year. Some components of the program require families or participants to complete meal applications that capture income information, much like the school meal application. As a provider, if you are interested in locating a child care center, or home that participates in CACFP, you can visit My Child Care DC and look for facilities that have the fork and knife in their profile. The red box at the bottom of the slide shows the 5 different types of organizations that CACFP serves and the age groups that are eligible for meals. As you can see, there is a CACFP program for almost every age group, and many different kinds of organizations can participate, including licensed child development facilities, after-school programs, before and after care programs, non-residential adult daycare centers that provide respite care, and emergency shelters that address homelessness or provide safe havens for families and children. Next slide, please. The next program I'll talk about is the Summer Food Service Program, or SFSP. Locally, this program is known as the DC Youth Meals Program. See the logo at the bottom of the screen. You may have seen that around, and you'll see it in the future. This program is also administered through OSSE. The program operates when school is out. This means during school's summer breaks and emergencies or disasters that cause schools to close. Organizations participating in the DC Youth Meals Program receive reimbursement funding for the meals that they serve to community children. The reimbursement rates are also set annually by the federal government, and the funding is designed to cover a portion of the cost of meals. Meals can be offered every day of the week, including weekends, or any day that fits the organization's operations. There is also a structured meal plan that organizations must follow, and this meal plan gives basic outlines of food groups and portions that must be served. And as long as the organizations meet the meal standards, they are allowed to serve meals that meet the needs and tastes of their community. For example, serving culturally familiar foods and vegetarian meals. There are also options to serve participants if they have allergies or need other special accommodations. Because most meal sites choose to or are required to make meals available to all children in the community, OSSE provides outreach and promotion support to organizations to make sure that their meal program is known in the community. So that's one benefit of enrolling in the DC Youth Meals Program as an organization. Children or youth that are either enrolled at a meal site or drop in just to receive a meal could be served up to or receive up to 2 meals a day, depending on which meals their location chooses to serve. And the meal options are breakfast, lunch, morning or evening snacks, and a dinner. Most meal sites are required to be open. This means that any youth up to age 18 who visits the meal site can receive a meal at no cost without completing any kind of application or showing ID. So this is a great benefit for our community. The blue box at the bottom of the screen shows the types of organizations or locations that can serve as a meal site. The primary purpose of the DC Youth Meals Program is to ensure that children and youth have access to meals during summer vacation. So this means that a meal site can offer a summer activity, which is shown to attract more participants to the program. However, an activity is not required. A site can choose to only serve meals which makes the program easy to co-locate where families and youth will naturally visit, and they don't need to go out of their way to find meals during the summer. For example, a meal site could be located at a farmer's market, a community swimming pool, or it could even be served from a mobile meal truck. If an organization wants to join the program, they should visit the OSSE SFSP webpage. And as a provider, if you want to help families or youth locate meals near them, there are 3 options. As you can see on the slide, there is a phone number that you can call and provide some address information, and you will get the closest meal site. There's a text number where you will provide the same information and be provided with the closest meal site. And there's also a website that has a searchable map of all of the meal locations available in DC. So thank you. And now I will be turning it over to Michael Rebar.
Thanks so much, and welcome everybody. Excited to talk about the Pandemic Electronic Benefit Transfer, or P-EBT program. As its name implies, it's a temporary federal food benefit for eligible children loaded onto an EBT card. And it started, at least in the district, our first round was implemented in May of 2020. And this was authorized under the Families First Coronavirus Response Act and has been amended multiple times under subsequent legislation. So P-EBT is a joint partnership in the district with the Office of the State Superintendent of Education, or OSSE, who we just heard from, and the Department of Human Services, which is where I'm from. So P-EBT eligible children are those who are eligible to receive free or reduced price meals under the National School Lunch Program, which is usually known as FARM in the district, at their school or in preschool. So this includes children in pre-K through grade 12, eligible to receive the National School Lunch Program, or FARM, or who attend a community eligibility provision school, or CEP school. In addition, for this last school year, children under 6 and who are also part of a SNAP household are automatically eligible. Each eligible children's benefit will vary depending on the status of their school, whether it's virtual or hybrid. So for this last school year, the benefit for virtual learning was $122.76 per month. And for children attending hybrid schools, it was $73.66. P-EBT benefits are intended to cover the breakfast, lunch, and snack. And like SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps, P-EBT benefits can only be used for eligible food items such as fruits and vegetables, meat, poultry, fish, dairy products, breads, etc., not prepared foods. Next slide. So P-EBT eligibility is auto-determined based on school enrollment and/or SNAP participation. So that means there's no application process for P-EBT. But District of Columbia families with questions about the P-EBT program in the district can call the P-EBT call center at 877-4DC-P-EBT or TTY 711. And the P-EBT call center is open Monday through Friday, 7:30 to 4:45. You can also visit our P-EBT website page. We keep that up to date with the latest information. And I just wanted to make a quick note on summer P-EBT. So the federal government has approved the district to issue benefits for summer P-EBT, but we're still in the process of issuing the last school year's benefits. So the dates for summer issuance are not totally solidified, but we do plan to start issuing summer P-EBT next month in September. And that will be a flat benefit of $375 for the summer. And eligible children will only receive this dollar amount regardless of the child's the school's operating status, whether it was virtual or hybrid. And children will be eligible if they received a P-EBT benefit for the month of June. And we'll have additional information about summer P-EBT on our website. Again, that's dhs.dc.gov/P-EBT. And with that, I will turn it over to Kimberly to talk about SMP.
Thanks, Michael. Good morning, I'm Kimberly. I'm a program specialist with OSSE's school nutrition team. So today I'm going to review all of the school nutrition programs that are listed in the toolkit. So many of you are probably most familiar with the National School Lunch Program and the School Breakfast Program, but there are additional programs that fall under the school nutrition programs. And these include the After School Snack Program, the Seamless Summer Option, which you've probably been hearing about a lot throughout the news last school year and this school year, the Fresh Fruit and Vegetable Program, and the Special Milk Program. So all of these programs provide a nutritionally balanced, low cost or free breakfast, lunch, snack, fresh produce, and or a milk option to children each school day in the district. So I'll start off with first reviewing which organizations are eligible. So DCPS, public charter schools, private schools, and residential childcare institutions, or RCCIs, schools that may have students living at them, are eligible to apply annually to all of these programs with OSSE. So organizations with the approved meal applications, they receive federal subsidy funding to offset the cost of providing the meals and the snacks to the students. And when organizations apply, they are considered school food authorities under the eyes of OSSE or SFAs, and they will be required to meet certain nutritional, meal, and administrative requirements. That's what Suzanne was talking about earlier. So similar to the CACFP and the summer food service programs. So they have to meet these certain annual requirements to remain in good standing and to continually receive the federal meal reimbursements. And then, like Suzanne mentioned, the reimbursements are set on an annual basis. So SFAs will be considered pricing or non-pricing based on a community eligibility provision or CEP formula that takes into consideration the percentage of a school student's participation in federal nutrition programs such as SNAP or TANF and household income. The non-pricing or CEP schools must provide breakfast and lunch meals to all students free of charge, while pricing schools will need to collect the farm applications that Michael was talking about from families and charge the families at a free, reduced, or paid rate that's dependent on household income or SNAP and TANF participation. However, I do want to note again for this school year that all schools have been given the flexibility from USDA to operate the seamless summer option, which I mentioned has been in the news. So under SSO, all students can receive all meals free of charge, just like this past school year, because of the ongoing pandemic and in the increased need for meal access at schools. And additionally, waivers are in place again for this school year that allow the meal service at schools to allow schools to provide meals at school and meals for distance learners through like grab and go meal service or even home delivery. And now let's switch over and discuss what's in it for the participants, the students and the families. So students that attend a school are typically in grades pre-K 3 through grade 12 in DC, although some SFAs cater towards adult learners, which may serve students older than most high school seniors. And as I mentioned before, students at CEP schools receive all meals free of charge, while some students at pricing schools may pay a reduced or a full price for meals. And SFAs participating in school nutrition programs can provide students up to 2 meal types, typically breakfast and lunch, and a snack to all students. Additionally, students at elementary schools that operate the lunch program and are in good standing and have 50% or more of students eligible for free or reduced price meals, they receive a fresh fruit or vegetable snack under the FFEP program if their school elects to participate. And now you may be wondering, as a participant in today's webinar, if there's a list of participating service sites to share with a family, a partnering organization, or a medical provider. So since schools are actively applying to all of the programs, even just this month, OSSE encourages families to reach out to their child's school to learn more about the school's participation in different programs. And schools that are interested may directly contact OSSE to see if they're eligible for participation. So thanks again, and I'm going to hand it over to Dari to talk about food resources for seniors.
Thank you. You can go. My name is Dari Pogash, and I'm a special assistant at the Department of Aging and Community Living. And I'll be talking about our nutrition programs for seniors, our federally funded nutrition programs for seniors today. Next slide, please. So under the Older Americans Act, which was enacted in 1965, we're able to support a wide range of social services and programs for individuals age 60 and over. And our major programs are congregate dining and home delivered meals and supportive services. Congregate dining is a community dining program that aims to provide nutritional support, food resources, as well as a socialization opportunity for people 60 and over. And the requirements are really quite broad. It's a very inclusive program. The program does target people who are low income and at risk of losing independence. If a spouse of any age can also attend the program, as well as disabled persons under 60 who reside in a housing program where the congregate meals are served, and those volunteers who work at the program. So the Department of Aging and Community Living typically has around 46 sites throughout the district. You may be wondering during the public health emergency what happened to our community dining, congregate dining sites. So in March of 2020, many of our seniors who are participating in congregate dining began receiving COVID-19 emergency frozen meals delivered to their homes. Starting in June and July, we've been reopening our congregate dining sites as the public health emergency has come to a close. And at this point, many, although not all of our dining sites are currently open, and we are encouraging seniors to return because this is again an opportunity to address some of the social isolation that has occurred during the last 18 months with the pandemic. But I do want to point out that seniors are not required to eat meals on site. The meals are currently prepared in a way that seniors can pick them up and take them back to their residence if they prefer not to eat in person. And these meals are available Monday through Friday from 10 to 2 at most sites. We also have a home delivered meals program, which is available to people who are 60 and older, and in some cases, spouses or disabled persons who reside with older adults. There is a more rigorous screening and assessment for our home delivered meal program. And during that assessment, the person's ability to prepare their own meal as well as their nutritional needs are assessed. And then it is determined whether or not they're eligible for the program. As I just mentioned, over the last 18 months, many seniors have been receiving COVID-19 emergency meals delivered to them. And so the lines have been a little bit blurred between these two programs, but these home delivered meals are really for when we're not in a public health emergency, are for seniors who really cannot prepare their own food, don't have assistance in preparing their own food, and aren't able to get out to get food for some reason. And then the Older Americans Act also funds supportive services, nutrition counseling, and nutrition education. Next slide, please. So if you know someone who's 60 and older who may be interested in one of these programs, how can you apply? You can call the Department of Aging and Community Living and speak to our information and referral and assistance hotline, and we will be able to connect you with the client application process and then refer the client to a local lead agency. Lead agencies are connected to each ward in the district, and they provide the nutrition counseling and education services that I referenced briefly in the previous slide, as well as they currently conduct the assessments for individuals who want to be assessed for home delivered meals. You have all of our contact information here, including our phone number, 202-724-5626. And I think Jessie is next. Okay.
Yes, thank you, Dari. All right, so the next two programs I will review are the Commodity Supplemental Food Program and the Senior Farmers Market Nutrition Program. In the district, these two programs operate together and are referred to as the Grocery Plus program. CSFP is funded by the United States Department of Agriculture. It's managed by DC Health, and it's administered by the Capital Area Food Bank. CSFP works to improve the health of low-income elderly persons by supplementing their diets with monthly food boxes of USDA commodities. Eligible participants receive 30 to 40 pounds of healthy groceries on a monthly basis through on-site pickup or home delivery. And food packages vary month by month, but typically include juice, packages of meat, shelf-stable milk, plant-based proteins, grains, cheese, and canned fruits and vegetables. In addition to the food box, participants receive monthly nutrition education materials to assist in preparing healthy meals. In order to receive CSFP, an individual must be 60 years of age or older, reside in DC, and meet income requirements. And you can connect residents to the CSFP by calling the Grocery Plus hotline or going to the Capital Area Food Bank's website for more program information. Next slide, please. Okay, so the next program is the Senior Farmers Market Nutrition Program, otherwise known as SFMNP. The SFMNP is just like the WIC FMNP, but for older individuals. The program is funded by the USDA, administered by DC Health, and it's implemented by one local agency, which is the Capital Area Food Bank. Individuals 60 years and older who live in the district and participate in the Grocery Plus program are eligible to receive these benefits. Participants in this program receive 10 $5 senior farmers market checks for a total of $50. And that is also the federal maximum. There was a question in the chat for WIC FMNP, but the federal maximum for senior FMNP is $50 per participant. And these participants can use the benefits to buy fresh fruits, vegetables, cut herbs, and honey from approved farmers at farmers markets in DC and Prince George's County in Maryland. And participants start to receive these benefits starting June 1st, alongside their CSFP food box, and have until October 31st to use them. And the impact of the program really aligns with the WIC FMNP. So it also improves diet quality through access to fresh and local produce, improves nutritional literacy through nutrition education, supports small farmers and the local food economy. And next, OSSE and DHS will talk about food resources for other adults.
Thanks. I will kick it off with the Supplemental Nutrition Assistance Program, or SNAP, formerly known as the Food Stamps Program. So SNAP helps low-income individuals and families by providing a monthly federally funded food benefit on an EBT card that can be used to purchase groceries at authorized stores, farmers markets, and certain online retailers. SNAP eligibility and monthly benefit amounts are based on a household's income, the number of people in that household, and receipt of other assistance, such as Social Security income. The SNAP program, it's open to individuals, families, seniors, persons experiencing homelessness, persons with a disability, many immigrants, and citizen children of non-citizens. Next slide. So applications for SNAP can be submitted online through the DC benefits portal. There's a mobile app called District First that can be downloaded on a Android phone or an iPhone, or customers can visit in person at one of our open service centers. And the link there will let you know which service centers are currently open. And any questions customers have can always call the ESA Public Benefits Call Center at 202-727-5355 or TTY 711. And that call center is open 7:30 a.m. to 4:45 p.m. Monday through Friday. You can also call a call center to have an application mailed to an individual as well. There's detailed eligibility information, including special rules for seniors, available on our website at dhs.dc.gov/SNAP info. And we also have a screening tool for customers that might be interested to see if they may be eligible. And that's available on the DC benefits portal as well. So with that, I will turn it over to Alicia, there we go. Thanks.
Hi, everybody. My name is Alicia DiCamillo Drummer. I work at the Office of the State Superintendent of Education, and I am the Community Program Specialist on the school programs team. And I'm here today to present on the Emergency Food Assistance Program, otherwise known as TEFAP. TEFAP is a USDA program that assists with supplementing the diets of low-income Americans by providing emergency nutrition assistance at no cost. And in the District of Columbia, TEFAP is operated through the Capital Area Food Bank and operates by distributing groceries to residents through food pantries and prepared meals to residents through soup kitchens. And to note, TEFAP can be accessed as often as needed by district residents. And also to note, TEFAP benefits and receiving TEFAP does not impact eligibility to receive assistance from any other USDA nutrition program. So to be eligible to receive TEFAP, district residents must have a household income at or below 185% of the federal poverty line, or households are also automatically eligible if they receive SNAP, TANF, or Medicaid. To receive groceries from a food pantry in the district, residents must certify annually using a self-disclosure form. So that is a form that they fill out one time per year at each food pantry that they're going to visit. And the required information is simply their name, address, the number of people living in their household, and self-declaration of TEFAP eligibility, meaning that district residents do not need to provide proof of their income or proof of program participation in order to certify for the program. And to receive prepared meals from a soup kitchen, there is no certification required. Residents simply visit a soup kitchen and are provided with a meal. So if there are any providers who are interested in working with the program who currently do not, you can contact the Capital Area Food Bank, which is who operates the program and contracts with all of the food pantries and soup kitchens that are providing the food directly to district residents.
I want to thank all our presenters. That was fantastic. I know I'm going to go back through and reread this, but right now we'd like to know if there are any questions. I know there was one question earlier and Jesse kind of answered it. And I'll ask Luis if he saw any additional questions or if anyone wants to raise their hand and ask a question. I see Rose Clifford has her hand raised. Rose.
Yes, thanks Beverly and everybody. Yeah, I'm not really familiar with TEFAP. That's actually kind of the first I've heard of it, but I wondered, is that something where, like I work with seniors at Iona Senior Services, and many of the ones that we work with would be frail, homebound, or isolated, and some of them are not frail or homebound, but they do lack transportation. Are TEFAP emergency groceries and meals, are they home delivered, or do clients have to go somewhere to get them? How does an individual client access this program?
Great question. Thank you. So TEFAP is operated differently, really differently between each food pantry that's operating the program. So just for an example, some food pantries operate TEFAP and distribute TEFAP foods twice a week, some are weekly, and some only operate the program monthly, which is all allowable. And then in addition, to answer your question, some of our pantries do operate home delivery services, whereas some of them you have to come to the food pantry to receive. One note though, is that every TEFAP food pantry that's operating where clients must come in person to receive the food, clients are able to identify a proxy who can pick up food on their behalf. So if the food pantry isn't operating a home delivery service, what a resident could do is fill out a self-disclosure form and identify a proxy, maybe someone who lives with them, a neighbor. If they're living in a group home, the person that's overseeing that home would be able to go and pick up as a proxy on behalf of the people living in that home. So I would recommend, I'm happy to help connect you with pantries that are closest to you to see how they're currently operating the program. And then if they're not delivering or providing home deliveries currently, to work out that proxy system so that they'd be able to access the program.
Thank you.
Does anyone else have any more questions? Okay, it looks like Barbara Herbst has a question. At risk of sounding naive, with so many great programs, why is there food insecurity in DC and gaps as well?
I'll try to answer that question. We do have wonderful resources in the District of Columbia. And what we realize often is that individuals may or may not have an opportunity to learn about them, which is why we got together and decided as a group that we should in fact have one place where people can find out what resources are available to them. We have to remember that many of the people that we serve, some are homeless. They don't have access to many other services. We also know that many of our service providers, as well as healthcare providers, are really overworked doing a lot of things. So we want to make sure that people have an opportunity to learn about all of these fantastic programs. And we hope that you, in fact, go out and let people know more and more about these programs. And I'll let any of the others presenters may want to answer that question.
Well, I'd like to toss out as a frontline worker who works with older adults that these are wonderful programs. And this was a great presentation. I hope we'll get the materials or the presentation. But it's still for a lot of the neediest people, it's the timing, they need food now or tomorrow. And they do not have a proxy. They need it delivered directly to them. This is a huge issue. And a lot of the seniors that we work with, they just don't have it all together. They may have some mild dementia or other capacity issues that prevent them from accessing it themselves. They really need like a food access navigator in addition to the delivery services. So that there's just that extra layer of complexity. That's my opinion. That's my experience over years of working with these people.
Thank you, Rose. I also want to point out that the DC Food Policy Council actually did a report last year on food insecurity. So you might want to go to their website to take a look at that site. And there are a lot of programs that are looking at food access. Particularly Rose brought up about our seniors, and we know that DC has the highest rate of food insecurity among seniors in the nation. So anything we can do in order to move that forward and help our seniors as possible. Louise, do we see any more questions? Or anybody? I'm going to try to look for raised hands.
Okay, I see another question from Ms. Smith. It says, is there any potential for more consolidated applications despite the fact that these are federal programs?
So I'm going to ask Michael to speak to that because DHS was absolutely fantastic in the early parts of the pandemic and moving us from our 18-page application process to the app. Michael, can you answer that question for us?
This is a very, be frank with you, annoying issue that many states deal with the federal lack of federal coordination from the federal level, right? So the states and the district can only implement what the feds allow us to implement, and we've been pressing the federal government to work more across HHS, CMS, HHS, ACF for the TANF and cash programs, and USDA FNS for the food programs, because they all have various different types of requirements that need to be on applications, and how you process those applications are different. And so especially in the pandemic, it became really clear that it's been, even the flexibilities that were coming out, there were variations across the agencies that made it extremely complicated for the district and other states to implement all of those flexibilities and programs. So it is something literally we're working on right now. It's a topic that comes up every week in our at DHS just for the programs that we administer. But with, and I'm just going to throw this out here as an idea, but with this toolkit that came out and kind of with the questions that are coming up, I wonder if there might be a coordinated effort kind of maybe supported kind of like the toolkit was and the food insecurity reports and all this, where we could have a place where residents can come to check their eligibility for the various food programs and kind of be directed to the application resources available, ways to simplify the process, because it is complicated, and a lot of that is driven by the federal requirements and the politics around food and low income individuals across the country. So it is something that DHS is definitely committed to, but it's tough to do, and we appreciate your feedback. I can tell you, DHS is looking specifically at seniors in the district and trying to ease those application burdens, at least for the SNAP or food stamp program. But in terms of consolidated, we're going to try. But the more consolidated, the longer the applications become, because all the requirements have to be on there. So, but we're definitely looking at that, and any feedback, insights you might have, we definitely appreciate it. And yes, I agree, the White House needs to get involved.
At the risk of upsetting the staff at DC Hunger Solutions, that is one of the things that we also try to do. So don't hesitate to call DC Hunger Solutions to help you with your challenge. And I'm glad we're working remotely. Shanita Ann has a question.
Yes, good morning. I wanted to clarify for the Emergency Food Assistance Program. Yes, ma'am. The information says that the intermediary or distributor will essentially be food pantries. Is that a loose term, or must it be a designated food pantry, or can it be community-based organizations and touch points with the public?
Thanks for the question. So food pantry is a food pantry is defined as a nonprofit organization. So you must be a 501c3 organization in the District of Columbia who's operating an existing food pantry program. So the food pantry program is a little bit loosely defined. So we have food pantries that are operated out of by apartment complexes. We have some that are operated by community-based organizations within apartment complexes, some food pantries that are operated out of churches, some that are operated out of schools. So it just has to be a 501c3 organization that is sponsoring a food distribution. And those food pantries must be contracted with the Capital Area Food Bank, which is who administers the program in the district. So OSSE contracts with the Capital Area Food Bank, and then the Capital Area Food Bank directly contracts for TEFAP with those entities annually.
Thank you, Alicia.
Thank you.
Do we have any more questions? Well, if not, I want to remind you that the Federal Nutrition Program Toolkit can be found at dchunger.org. Please don't hesitate to reach out to us, look at this. And I want to thank you for attending this. It really is important that we have everyone in the community helping to serve everyone in the community. And I think I may have upset one of my staff members. India, would you like to say something?
I just wanted to piggyback off of that previous question. I was going to actually direct it directly to, is it Eliza or Elis? I don't want to pronounce your name.
Alicia.
Alicia, okay. I was going to actually direct it to you specifically, but I was just going to say, is that the same way a nonprofit organization can become an authorized food distribution site, is connecting with someone at OSSE or at the Capital Area Food Bank?
What do you mean by an authorized food distribution site?
If the nonprofit organization wants to become a distribution site, is it a specific process? Are they going to have to contact OSSE directly, or contact the Capital Area Food Bank directly, or just wanted to know the process there?
So if you're looking just to operate a food distribution program, to be totally honest, I'm not sure if there are any district requirements on distributing food in general. If you're operating a grocery program, what most people do is they contract. So you would not contract directly with OSSE or have to reach out to them. I'm happy to help you through the process if you're looking to start one or looking to get certified. But what most people do is they contract with the Capital Area Food Bank. And the reason being, Capital Area Food Bank is part of the Feeding America network of food banks across the country. So there are just a lot of benefits of being a partner of a food bank that's within that network. You get access to all of the food that they have in their warehouse, which you get at a discounted cost. So for example, somebody may be operating a food pantry on their own, and they're currently purchasing all of the food from Costco or the grocery store, or trying to rely on private donations. Whereas when you're purchasing and you're a partner of the Capital Area Food Bank, you get all of that food at a discounted cost. You're just paying a shared maintenance fee. So it becomes much more cost effective to run the program as a partner of a Feeding America food bank. And so in the district, that's working with the Capital Area Food Bank directly. And then also by partnering with the Capital Area Food Bank, you then get access to the TEFAP program and the other federal programs that they operate, just in the sense that you can partner with them on those programs potentially as well.
Great, thank you so much for that clarification.
So I want to thank everyone again for joining this. We know that it's important for all of us to be a part of this in order to end hunger in the nation's capital. Please remember that the tool site is on dchunger.org. Do not hesitate to reach out to us. If you have additional questions that you think about after this is over, you can send them to DC Hunger Solutions. We'll try to get them answered, and the materials will be sent out to everyone who has registered. And once again, I want to thank everyone for being here, and everyone for thinking about those individuals in the District of Columbia who need our services, who deserve our services. We believe that having access to healthy, affordable food is a basic human right. Thank you and have a wonderful day.